Hey, good morning, everyone. Welcome back to my YouTube video channel. I have two experts on my platform today. I'm honored to have the founder of iVeneer, Dr. Itay Mishaeloff, and
Hi.
I'm honored to have the course instructor of iVeneer in America. First time, Dr. Lundon Albrecht, right? Did I pronounce your name correctly?
It's good. Albrecht, yeah, it's good.
Albrecht.
A
And
very talented one.
I can't believe finally we are together on the one platform to discuss about the latest technology in dentistry for making the general dentist life or prosthodontist life easier. The iVeneer solution. What is iVeneer? iVeneer is the instant veneer in your office. So very excited to have the founder and the instructor first time in US that we're going to implement the iVeneer course, and it's going to be an awesome event shortly. So let's talk about iVeneer. Welcome to my channel, Dr. Itay, Dr. Lundon. Please introduce yourself. How did you get to know each other and all about that stuff?
So go ahead. Well, actually, I can tell you how I found Dr. Itay. I teach ways to simplify bonding for Colteen, and I had a lecture coming up, and I was basically Googling some things. Oh man, sorry, my little daughter. I'm on babysitting.
That's okay.
We want to see
We
her
love
face.
kids.
We want to see her face too.
I fixed that. Say hi.
Hello, Kitty.
Hello.
Okay,
That's
so
awesome. She's on the TV now.
had to fix her toy. But I was getting ready to do a lecture on bonding, and I had come across a Facebook like advertisement or something for iVeneer, and you could see the injection molded composite, and I was like, this is a lot similar to a lot of the things I was doing, but it was just a really innovative, definitely a much simpler process. And so I like reached out to them and said, hey, you know, I have a lecture coming up. Is there any way that I could try iVeneer? And they instantly got back to me and said, we'd love to help you. And I you know, about a week later, I get this package from Tel Aviv, Israel. And I was like, what? I open it up. And right when you open up the iVeneer package, I mean, it comes in, it's such a nice little form. It comes in like, it just looks so sleek, like modern design. I was like, oh, these are awesome. Like you could just tell. Even I mean, so I was all excited, and then instantly I got into work the next day and was just like looking for a patient. I was like, yeah, you're getting iVeneer. So then
exactly. It's very similar to me, you know, when now when we look at when I look at the other design from other company, and I go like, it doesn't seem like I know iVeneer yet. Like they design like a little matrix around on the facial aspect only, and then you put composite in, and then you have to work so hard to smooth it out. It's painful, but this is different, right? So
simplifies the whole process. I mean, if you can squirt out flowable, you can do cosmetic bonding. I mean, it's that easy.
Yeah, probably this doesn't need to be a dental licensed dentist at some point.
Which is dangerous. It might be dangerous, yeah.
Right. But we, of course, the dentists have to go with occlusion, check the bite and all of that, and you know, the ratio and all of that. Dr. Itay, tell us a little bit about your progress in teaching and everything at your place in Israel.
Okay, so my name is Dr. Itay Mishaeloff, and I'm the inventor. And actually, I started thinking about this matrix or template system 5 years ago, approximately. And since then, we are working on it, and we've just launched it. Yes, it was a long road because such a small piece of plastic, it was very difficult to design and to manufacture it, but we did it. And today I do hands-on courses in Israel every week almost.
Wow.
between 10 to 15 dentists attend. So I do a small lecture, not a big one, because we believe that this should be simple. And afterwards, we do a hands-on on different models, and the doctor just love it. So there is a small learning curve, but basically it's only tips and tricks, and Lundon can tell you about it.
Absolutely. Dr. Itay, I want to touch right on the target is, before we got on the show, you mentioned that your life is simple now. Your dentist life is simple, very simple now when you come to your office. Can you tell us, like, what is your actual activity daily when you work with the patient right now? What type of patient you're dealing with?
Yeah, actually my clinic is 91% only long-term composite bondings. So I do just composite bonding. It can be composite veneers or other, class 4 or 5, and of course composite bonding. But actually, I did everything, and I tried everything, and it came out that because of the eye veneer, okay, and because I was concentrating on composite bondings, that's what I do today. Only composite bonding, and my clinic is not a big clinic. It's a kind of small one, and it's just me. And I feel that I have a lot of work only with composite bonding, and that's what I would like to do, and to stay with it. And even from if we're talking about the income, so my income increased by far since I do it, and this is my journey.
So you are the most popular guy now in Israel now. People are gonna fly over your place from other country as well.
Actually, I think I'm kind of different in the field of dentistry as a dentist, because it's exceptional when you tell or other dentists that you do only composite bonding and you don't do anything else. They look at you and they don't understand. But this is the reality, and actually I'm different also in the way I advertise myself. So I give consultations through WhatsApp, okay, and Facebook. So the patient doesn't have to come to me directly, and I don't have to sit with him and explain him the treatment plan, because it's so simple. They just send me the pictures, and I look at the pictures, and I tell them, okay, you need to do this and this, and then they just come for the treatment. So I know it's exceptional. I know it's different, but this is the way I work. And it is only because this is composite bonding. This is additive dentistry. This is real cosmetic dentistry. And I think it is possible. I do it.
I love it, but I think there's nothing wrong with what you're doing, because technology right now is allow us, we call teledentistry. So we communicate with patient through the app, like any app, as long as we able to communicate, see the picture, and we send back and forth, and that's what the world is gonna be. Dr. Lundon, could you tell us a little bit more about how excited you are when you see like an eye veneer case, like you go like, oh, I'm gonna do this. Tell us about like how excited you are with the journey that you've been with this technology.
Yes, I mean, as Dr. Itay just said, like he's practicing a new age of dentistry. He's using modern technology to make his practice easier. And that's what eye veneer is. It's like a new age, modern way of doing bonding. And so it makes it easier. It makes your practice and your life easier. And so anytime I see a case come through, so I think like most practices in the States, I have a regular, just run of the mill, almost blue collar type practice. And so you'll get patients that want their teeth to look nicer. With filters and the way things are now with Snapchat and selfies, everyone wants nicer, whiter, straight teeth. And when you present veneers to them, or porcelain, traditional, or no prep, lumineer, whatever they are, if you present the cost to them, I would say there's a percentage in every practice of all those treatment plans that you give for veneers. There's a small percentage of people that actually can afford to pay and go forward with the treatment. So for those patients that can't afford to do all that expensive cosmetic work, they can come to the middle option, which is a composite veneer. And that's where iVeneer comes in, is that now with iVeneer, because it's faster, it's easier, it's simpler to do bonding, you can also treat more cases than you ever could before. Those cases already exist in your practice. It's just now with a more affordable, easier, better option, you can treat way more patients, and you can enhance so many more patients' smiles. And so the chance of when I see one, I'm like, yeah, let's do this. I get excited for it because I like the instant transformation. Like, there's nothing better than giving them the mirror after the appointment and they look at it, and the first time they see their smile and they're like, oh, this is awesome. Like
the YouTuber that you posted, it was amazing.
Yeah, yes. There was a guy on Instagram. He was a really nice patient, and he posted a big thing. And it's things like that where those are the parts of being a dentist that are great. When you're able to see that you help somebody and you can transform their smile and transform their lives just by enhancing their smile, where if you don't have iVeneer in your practice, you're missing out on those opportunities.
Absolutely, I agree. Like the other day, one of the patients came in and the orthodontist did Invisalign, brace it for her and then Invisalign for her. And then he left an open space there. And I did, clean in, take care of her. And I say, wait, I'll help you right away. You will see, you will get surprised. So as soon as I finished that, she look at the mirror and she like, wow, this is the experience I never experienced before. Like the first time I got something, and now I don't have to worry about this. She was so happy. So an instant, gratification from the patient. It just make the dentist life happier because you get the tool that accessible for everyone. And yeah, it's the same thing. It's so beautiful.
Well, I think that's been the little problem with bonding. Coming out of dental school in the States, you really aren't taught a lot of bonding. You don't really practice that. And then coming out, I think a lot of maybe dentists just don't feel comfortable that they have the hand skills to attack bonding, or they've done some bonding in the past and it kept chipping or breaking, or it just didn't turn out right and they got stressed about it and it was a stressful procedure. And this iVeneer injectable matrix has basically taken the stress out of that. Like, you're not having to worry about shaping and getting the contours of the interproximal line angles. It's already done for you. All you're doing is just injecting flowable or heated composite. There's two ways to do it, but either way, the shaping, the polishing, it's already done. You just got to smooth out some things, and there's a little bit of a learning curve that we can go over, and that's what I think the hands-on course is so useful. If you can come to the hands-on course, you'll get more experience with that.
Do you guys see my screen or no?
Yes.
Now yes.
Is that just it's only just a screen about the iVeneer, right, or something else?
So on the bottom right there, it's showing you, which is good. It says the date. It's October 14th at the U.S. headquarters Coltine location. Coltine is a dental manufacturer, global dental manufacturer. The headquarters is in Switzerland, but their North American headquarters is in Cuyahoga Falls, Ohio. And they've gone ahead and put together a brand new teaching learning center facility with a full functioning operatory. And so it's state-of-the-art hands-on learning center. But Coltine's been a dental manufacturer of everything from endo ice to hygienic rubber dam to they own Cycan, the autoclave, to biosonic, ultrasonic, paracore, parapost, affinis. They make everything. But what's cool about this course is right there, how you showed the iVeneer package and the iVeneer kit. And so when you take this course, not only do you get to do the hands-on workshop with eye veneer, but you're going to leave with a whole full set of eye veneer, which is equivalent of, oh man, how many veneers is that? It's something like
128.
Yeah, you're going to leave with 128 matrices. So you can do 128 veneers. So you're already coming out of this ahead. You do one veneer, you're already in the money. You're already profitable. So it's just crazy that Coltine and eye veneer have kind of partnered together to do this great course. And the point of it is that it's something that I really feel like, and I'm sure Dr. Itay feels the same way, is something that should literally be in every dental office.
Exactly.
This should be an option for every dentist in their practice.
Exactly.
I know some of my friend already purchased your stuff, Dr. Itay. Yeah, he love it. And he's a pediatric dentist. And
Pediatric.
Yeah. And
You
he
should,
said,
yeah, actually.
Yeah, he
actually,
said like, Long, tell me more about it. I say, you don't need to, there's not much to tell. Just try it out. And he bought it and he loved it.
But okay, I think the teeth might be too big, no? Or
No. He doesn't use it for mixed and baby teeth. He uses for adult teeth.
okay,
Yeah.
now I understand.
But basically he's a general dentist, but he does majority of pedodontist. But he occasionally some of the patients come with a broken teeth, like 16, 17 years old, and he got stressed out. Like, how can I do it?
Yeah.
I don't do much with composite. I say, now this is a chance for you to fix it up.
That's a perfect example. That's somebody that's not doing a lot of cosmetic bonding, that in the past would be afraid to bond that or be stressed about it. And instead he just puts a matrix on, squirts flowable, boom, perfect. Like that's where, that's a perfect indication. And for all the people that, it's not like you need to be doing cosmetic bonding in order to do eye veneer. This is actually more for people that if you're doing cosmetic bonding, perfect, add this to the bag in your office. But if you're not doing cosmetic bonding, this is the perfect opportunity to start doing it. Yeah.
So Dr. Itay and Dr. Lundon, share us a little tip in terms of when a dentist or a patient asks like, how long this case gonna last? You give or how many years it's gonna fade away? Can you just tell us what you say before?
Lundon?
Okay. And so there's a few things with that. One is in the past when bonding stains, and that's the difference. That's the knock on bonding, is that it'll stain faster than porcelain veneers because of the surface. And a lot of that happens because when you're moving composite around and you're either using a wetting agent or you're incorporating different layers, there's a chance that you can get micro gaps and voids and irregularities. And those are the areas that will stain with bonding. With eye veneer, what's nice is you have a smooth internal shell that is basically being flowed in with one smooth surface of flowable or warmed composite. And so you're getting a really smooth pre-finished like surface. So I do think that there's a less chance of seeing that staining and micro gaps and bonding irregularities in the future. But what I typically do tell patients is I say, even with crowns, I say insurance picks up a crown usually every 5 to 7 years. And those are crowns that are made outside of your mouth, like in a laboratory in a perfect setting. And every patient's different, but I would say bonding should be somewhere in that category. I see bonding that's lasted, that's 15, 12 years old that still looks great. So it's hard to say an exact number, but I think Dr. Itay agrees kind of around that 5-year mark, right?
Yes, I always tell my patients, it's not that after 4 or 5 years you will find this bonding on the pillow. It won't happen, maybe it will chip. Maybe you will have to do some finishing and polishing, but it is a 5 minutes treatment, and it will last then maybe another couple of years. So and you've been really conservative with them, so with their teeth, with their structure. So I think it's a win-win situation.
Yeah. So just to give you an example, my brother-in-law and my sister, two of them have eye veneer, and I will worry that, man, I don't know, I want to make sure that it's gonna last. So I didn't talk to them for 2 months. I went back to last time I was driving with my brother-in-law next to him. I'm like, hey, let me take a look at your mouth. And he's still brand new and it looked beautiful. And I'm like, good, good, that's good. That's good news.
That's good.
I did this for my sister about a month ago. And I say, just in case anything happened, you gotta let me know, right? It's been a month, they haven't talked to me. So that means that's good. So
I think a good part of that too, like Dr. Itay said. So, I mean, the number and how long, obviously you can't put a time on it, but if something was to happen, say they chipped, right? Say you had a part of the eye veneer chip or some bonding chip off of there. That's what's great about eye veneer and bonding, is that if that was a porcelain veneer, you got to take that off. You got to get a new impression. You got to send it to the lab. You got to hope the lab makes the exact same veneer and the exact same color. And
yeah,
so that's the stress. Where this, you take the stress out. If someone chips one, you're like, roughing it up, maybe add a little composite, add a little bonding, a little more flowable. You're done. Like it's a 5-minute fix, like he said, if something did chip.
yeah.
And
I
so
mean, honestly, this is something like it's all based on our clinical skill. The more we do, the better we get, and we have to understand the anatomy, understand the occlusion, the bite, and everything. And every dentist have the background like that, and it just takes time to earn that type of skill. And once you become really good with that, you can foresee what's gonna happen, and you have to adjust the bite in the bottom and whatever it takes to make sure that the patient have reasonable bite. To avoid, just similar to veneer, regular veneer or crown, you have to make sure the bite is proper before you let the patient go home. That's the key. Instead of like, okay, you told me to do this and now it's breaking. That's because you don't even check anything, right? It's including the regular veneer, including the crown, including any cosmetic dentistry that you do. You have to make sure that patient have proper bite before you send them home. That's the key, right? So that's how it gives us a longer term. Yeah,
exactly.
And occlusion is the key, of course.
And obviously with bonding is when it comes to composites, you're going to get a stronger bond to enamel than you are to dent. So if you're not reducing the tooth and you can stay in enamel, obviously you're going to get a stronger bond than you would if you reduce the tooth and got into dent. And with eye veneer, the way it's designed, I mean, it's very minimal prep. Like, I mean, most of the times it's no prep. And there are times where I roughen the surface up, or maybe if a tooth is extremely flared, you reduce some more. But typically you're not causing any harm to the enamel or to the tooth, and you're able to kind of obviously enhance and give them a lot nicer smile. And so there's a lot of things about it that make it so nice. And I do think trying it, learning it, and that's why that hands-on course is really nice. If you're able to come and try it and use it and practice it, and you'll leave comfortable, and then you'll also leave with a full kit of composite and eye veneer. Can't beat it.
October 14,
yes,
in Ohio, right? In what do you say this city?
Cuyahoga Falls. It's real close to Cleveland, so you can fly into Cleveland. Actually, that weekend, the Browns play the New England Patriots. So you could even come in, go to the course, and then see the Browns play the Patriots the same weekend. How cool is that? It's right by Cleveland.
In case if they missed out our conversation, what do they search in order to get information? Go to Cotin website or your website, or?
I think you would probably go through Colting. Yeah. So that's going to be that's their learning center. That's their Colting Education Academy that they've created. And so you would probably check out Colting, COLTENE. There's going to be a lot of media coverage about it, just because this is such a new thing that has come to the United States, which is going to be like I said, a procedure that can be added to every single office. It's a service that is available to every patient in your practice that is looking for a way to upgrade their smile without having to do traditional veneers. And so I think it's something that will be available to every practice and should be in every practice. And Dr. Itay is he's the inventor, the founder of it. I mean, this was a vision that he had in Israel, and it's going to go global. And I think everyone's going to be using it in their practice.
Yeah.
Super awesome. Super awesome. I mean, this just your experience in London with very similar in terms of like how I try to look for something better, easier for my life in composite. And when I see this video, I'm like, oh my God, I need to look for this person. Who is this? You know, and awesome that we connected. So the word is making our life easier. Dentistry is easier. It's no longer we're going to be practicing in our office and we don't communicate, but now it's just everywhere, anywhere around the world. Whether you are in China, Vietnam, you can contact us, learn more about this technology, and we will certainly be more happy to introduce you to the product, any of us in here. So thank you, you guys, for the quick talk. And I really appreciate that one day we're going to see each other in one room together, and that will be a future right there. And I'm looking forward to do that soon. I already talked to people. So,
it will happen.
We want to bring you to the World Doctor Gala information. Have you heard about it? It's going to happen in Italy in June 8 to 10 next year.
Okay.
You guys should attend it, and I want to include you guys as part of the dream team. It's going to be thousands of doctors in there, and we showing the best stuff of the dentistry, anything the best. We're gonna, and I believe it's gonna be there. Yeah.
No one's gonna say no to going to Italy. I mean, I'm always down to going to Italy. That sounds amazing. Yeah,
I'll share with the flyers, you guys. Dr. Itay, check it out. I'll share you both. It's
I will,
awesome.
of course.
And also, I want to invite you guys to a global summit academy conference. So what we're doing is we're doing the same thing what we're doing right now, but it's gonna be on a platform where thousands of dentists around the world are gonna listen to us conversation. Same thing that we're talking right now, but it's gonna be a bigger platform.
Yeah, so Lundon should talk. His English is better, so let's
we'll bring together. This is something that, you know, it's sometimes like it's hard to have like one or two person, but when we have a group of people like agree on certain things, it's gonna blow up people's mind, like, you know, give them attention, you know. Yeah, so I want change. I want change for everything. I'm not a guy where I just want to hold back anything that I learn. I'm the type of guy that I want to, you know, contribute to whatever, you know, the field that I'm in, help people out and make people easier. You know, veneer, it make your life less stress. That's the key, right? Don't you feel that? Your life is less stress. So why not, right?
Yeah, for sure. I hope they will understand it, but yes, this is the whole idea.
I'm going to stop recording, and so just want to say thank you, but you guys are going to be online. Okay, I'm going to stop this right quick.